manifestation للجنرال فيزيكال اكزامينشن. يعني لو امتحنت حد تشيست الاكزامينشن الثاني حيكون جنرال فيزيكال اكزامينشن، امتحنت حد ابدومين حيكون الثاني جنرال فيزيكال اكزامينشن. because of it is important especially for the 4th year student beginners. يعني يمكن في ال 6th year نحن نشتغل نعمل examination للهم examination للarterial system، لكن في ال 4th year usually we concentrate on the general physical examination. So that give attention to this demonstration of the general physical examination. The general physical examination first start with describing the general conditions of the patient. يعني general condition of the patient. What we mean by general condition? العيان نايم مرتاح ولا ما مرتاح؟ Is he lying flat comfortable in bed? Is he sitting in a chair? Is he walking؟ مش كده؟ مرات تشتكي العيان بيتمشى في الورد مش؟ أو تكون أنت بتعمل examination at the outpatient clinic في العيادة الخارجية، العيان يجيك ماشي يقول والله on inspection of the patient he's walking with limping مش كده؟ يكون في problem. يعني general physical examination ده even the position of the patient it gives clue to the disease. مش كده؟ لو لقيت عيان جالس على كارتك كده ده عنده مشكلة في القلب مش؟ إذا كان جيت لقيت العيان يتسرع في السرير أنا عنده مشكلة، ممكن يكون renal colic مش؟ يبقى the general position of the patient is important for evaluation of the clinical status of the patient. Okay? أنت from the start تقول the patient is lying flat comfortable in bed, the patient is lying on cardiac bed, the patient is rolling around in bed مش؟ The patient is sitting in a chair, the patient is walking. يبقى this is the position of the patient. If the patient conscious and oriented without examination انك تيجي تسأله إذا كان لقيت العيان جالس كويس ويتكلم كده معناها he is oriented. Is there any attached tubes like IV lines, nasogastric tube, ventilator اللي هو endotracheal tubing مشكلة؟ catheter, brace, chest tubes. يبقى these are tubes can be attached to the patient. If there is any one of them you will comment on it. The patient has an IV line on the left antecubital fossa. The patient has an IV line on the right. The patient has a nasogastric tube. The patient has endotracheal tube attached to ventilator. You've got a tube that is connected to the patient, you have to comment on it. Is the patient attached to monitor? محطوط على monitor محطوط الأكسجين saturation probe on him or not? This is important. مش كده؟ العيان يكون في الجنرال وورد they don't need frequent monitoring. لكن عيان لو في high dependence units، عيان في ICU، عيان critically ill you will attach him to continuous monitoring مش كده؟ عشان لو في drop في الأكسجين saturation، لو في irregularity in the pulse rate or drop or increase in pulse rate can be detected early. Because this is important to describe in each patient. Is there oxygen mask? يتحقن oxygen mask with dyspnea. All these general condition of the patient you will comment on before touching the patient. You comment on the surrounding. You comment on the position and state of the patient. You comment on any attached tubes to the patient. Okay. Then you come. This is just you did not touch the patient. The كله general inspection, general comment. Then you come from the right side of the patient. Examination of any patient should be conducted from the right side of the patient. Then you introduce yourself to the patient. Well, I am Dr. Haidar Osman. I am a general surgeon. If you don't mind, I would like to examine you. You give permission. Okay. Then you start this examination of the hand. What signs you want to elicit from the hand? And you start with shaking hands with the patient. You start shaking hands with the patient. You are making yourself closer to the patient at the same time you are starting the examination. Okay, when I touch his hand like this, shake his hand, I can check whether he is febrile or not. Temperature, مشكلة? If he feel hot or cold, in patient, for example, with hypothyroid or patient in shock, once you touch your hand, you will find it cold. Is it dry or moist? Dry or moist? It differs, مشكلة? Patients with cytotoxicosis, they have warm, sweaty hands. Warm and sweaty hands. Patient shocked, ناس نايمين, they have cold, sweaty hands. Patient who is anxious, anxiety, will cause also cold, sweaty hand. This is just from the touch of the hand. Then you look to the palm of the hand. Palm of the hand. For pallor, for erythema, for tubital contraction, مش كده? For muscle wasting, you look over the thinners and hypothenar muscles for wasting. Then you turn the hand around. Okay, looking for also muscle wasting. In the intercostal space, look for splinter, hemorrhage, look for leukonychia, chorionichia, clubbing of the fingers, all this from the back of the hand. Then you go to examine the pulse. Pulse. How we examine the pulse? Check hand of the patient, make little wrist flexion, and then use 2 or 3 fingers with their tips of 2 or 3 fingers, and you put them over the radial artery, pressing the artery against the radial bone. When you examine the pulse, ما تحط اصبع كده ولا تحط ايدك كلها تعمل لك كده I'm checking the pulse. This is not right, مش كده؟ To feel the pulse, you need to use the tips of your fingers, either 2 or 3 fingers. You put them aligned with the direction of the artery, pressing the artery against the bone, against the radial bone. This is how to check the pulse with little wrist flexion. The wrist flexion will relax the artery from tension. لما يكون الهاند كده hyperextended, الارتري يكون مشدود. When you make little flexion, the artery will be relaxed, so that you can compress it against the bone. What we want to know about the pulse? عايزين نعرف ايش عن البلس. ها؟ Rate? Rate, what is the normal rate? 60
60 to 100.
to 100. This is important. ما يجي واحد يسأل في الامتحان what is the normal pulse rate؟ يقعد كده والله يجيب رقم from his own. ها؟ لازم should be on this. Pulse rate from 60 to 100. Less than 60 we call this bradycardia. And more than 100
Tachycardia.
tachycardia. This is regarding the pulse rate. What else about the pulse? Rhythm. What about the rhythm? Regular or irregular? If it is irregular, then it would be irregular or regular irregular. مش كده ممكن يكون الخلطة هذه منتظمة أو يكون الخلطة نفسها غير منتظمة. Like in atrial fibrillation مش كده؟ Like in atrial fibrillation. What else you want to know about the pulse? Volume. Pulse volume. Is it important, pulse volume?
Yes.
What's the importance of pulse volume? إذا كان اللي بيدي small pulse, ready pulse, that means this patient is hypovolemic. هذه السيرجري مهمة جدا مع hypovolemic. Would be due to hemorrhage مش كده؟ العيان تروما يجيبوا لك تروما. Once you catch the pulse, you will find that small pulse volume. That means this patient is hypovolemic, might go to shock. What else about the pulse? Now this is rate, rhythm, volume. في حاجات حقت مصل باطنية انما
الكاركتر
الكاركتر والسينكرونستي والريدو فيمورال ديلي هذه نحن في الجراحة ما قاعد نشتغل. بيهمنا في الجراحة الريت والفوليوم والريتم. The pulses are very important to us. What's next? You will start measuring the vitals. بعد ما عملت الهاند examination and you check the pulse in the hand, then you will attach a sphygmomanometer to the arm and check the blood pressure. How to check the blood pressure? حتى السبانيتر كف هنا في الارم tracheum. Call this tracheum, صح? And then?
compress the.
Yeah.
احنا نسوي نرفع اليد above the
The level of the heart.
heart and show the volume, the volume of the blood. It's high or
Okay. Anyone want to add more? Explain more. حصل عملت البلود بريشر قبل كده؟ ها؟ ما عملت. عندك السيمانومتر في البيت؟ Everybody of you should own sphygmomanometer, either pneumatic or mercury. And then he have to train himself to do as frequent as possible blood pressures. نمسك ناس البيت كله measure blood pressure. So we'll be very happy that. Our daughter is checking our PP and this is training for you. You, when you apply the cuff to the brachium, As she said that, you put the bracket at the level of the heart and then feel the pulse. We call this what pulse?
The
Brachial artery pulse, مش brachial artery pulse, and then start inflating the sphygmomanometer. الكف تبدأ شنو تنفخ الكف تاع السphygmomanometer till the pulse disappears. انت حاطط يدك هنا الى ان يختفي معك شنو؟ البلس. زيد تاني 20 او 30 ملم mercury, and then you put your stethoscope here at the pulse site and then start deflating the sphygmomanometer slowly till you hear the first pulse cut, and you record this one. This is the systolic blood pressure. You see? Huh? Yes. Apply the cup of the sphygmomanometer into the brachium of the patient. Make the arm at the level of the heart, and then check the the brachial pulse, and start inflating the sphygmomanometer cuff. تبدأ تعبي في السphygmomanometer cuff while you are still feeling the pulse till the pulse disappears. When it completely disappears, increase 20 to 30 millimeter mercury more, and then put your stethoscope and start slowly deflating the sphygmomanometer cuff. تبدأ تنفسها. Once you hear the first beat by your stethoscope, this is the systolic blood pressure. You record this. For example, you hear the first beat at 125, then the systolic blood pressure will be 125, and continue deflation till the pulse disappears. You can hear no more here, or change in sound, And record this one as the diastolic blood pressure. This is how to measure the blood pressure. Okay. But the second thing is to measure the blood pressure, and then you go and measure the temperature. What is the apparatus used for measuring the blood pressure? Apparatus name for measuring blood pressure. Which device, which instrument we use to measure the blood pressure? اسمه شنو الجهاز اللي بنسبه هذا؟ ها؟ Yes? Sphygmomanometer. And this one سماها وش اسمها؟ Stethoscope. مش كده؟ Stethoscope. Temperature is measured by what temperature? Measured by what? Thermometer, صح? Thermometer we use it to measure the temperature. From which point we check the temperature? من وين نقيس الحرارة؟ على حسب. Yes. يمكن من الارم بيت مش؟ From the axilla you put the sphygmomanometer here and hold it for 1 minute and then you check. Or from the mouse مش كده؟ Oral temperature. Yes, what else? Where else? Huh? From the tympanic membrane مش؟ Measure of tympanic membrane. Where else? What is the most accurate one? The most accurate site to check? Huh? Rectum, and we call this the core temperature. Core temperature is checked from the rectum. This is the first side. Because the others هنا لأنه في الإسويت مش كده؟ الإسويت ممكن يخلي الاريا colder. في الماوس نفس الشيء. في الإير نفس الشيء. The most accurate one is the rectal temperature, and we call this the core temperature. What's the normal temperature? 37. 37. This is the best temperature. This is the normal temperature. And the blood pressure, normal blood pressure?
90 to 120.
One? Normal blood pressure. يلا يا شباب. Yes?
120.
120
Above 80.
over 80. هذا أحسن واحد. 120 over 80 is for the young people. And the person advanced in age, the blood pressure normally get up. مش كده؟ It's normally get up. لكن بالنسبة للناس اليوم, the normal blood pressure is 120 over 80. What's next after checking temperature of the blood pressure? You will check the respiratory rate. How to check the respiratory?